Get ready to listen, learn, and earn CE hours. This podcast features content from an accredited CE activity provided by Colibri Healthcare. Visit elitelearning.com/podcasts for accreditation and disclosure statements and instructions on how you may be able to earn CE credits.
Hello, I'm Dr. Candace Pierce with Elite Learning by Colibri Healthcare, and you are listening to our Elite Learning podcast, where we share the most up-to-date education for healthcare professionals. Welcome to our podcast series on facial aesthetics, where we're going to be talking specifically about collagen and skin rejuvenation. Now, according to the American Society of Plastic Surgeons, each year over 70% of patients who are seeking aesthetic treatments report concerns about skin aging. That's going to include wrinkles and loss of elasticity. And over the last few years, there's really been an emphasis on collagen-focused treatments, not just for patients, but also for healthcare providers who are stepping into this field. We're seeing more registered nurses, nurse practitioners, physician assistants, all moving towards this area of healthcare. Now, I personally know a few nurses who have trained in this area as injectors and who have either moved into this area full time or more as a secondary role for extra income. So this is definitely a smaller area for healthcare, but it's a growing area. Now, in this first episode, we're going to look at the science behind collagen, its role in maintaining skin health, and how it's changing with aging. And our goal is really to provide you with a comprehensive understanding of collagen to better support patients who are seeking skin rejuvenation treatments. And joining us for this discussion is Kathleen Woltz, a nurse practitioner who specializes in this area. Kathleen, thank you for joining me.
Thank you, Candace. I look forward to this.
Yes. Now, this is our third attempt at trying to record this podcast. So I'm really looking forward to chatting with you today.
This one, yes.
Yes, we've had some technical issues, and so hopefully we get through this one today. But I just want to say that I just love your joy and passion for this area. It's so apparent, and I'm so excited to learn from you today and to really figure out this area of healthcare.
Well, thank you. I'm excited to bring up the topic. I think aesthetics is growing, as you said, and it is growing in regeneration and rejuvenation, which collagen fits right into.
Yes. So start off with, what is collagen and why is it essential for skin health?
So collagen is a protein that plays a key role in the structure and strength of the body. So we have collagen everywhere. We have it in our skin, our muscles, bones, tendons, ligaments, connective tissues. And what it acts as is kind of the glue. So it holds everything together, provides support, provides elasticity, and provides firmness. So in the area of the skin, it helps to it helps the skin stay firm. So it prevents those fine lines and wrinkles. And unfortunately, as we age, our collagen production also decreases. And so then that leads to sagging skin as well as like joint discomfort. So it's really about the structure and the firmness of collagen that's kind of supports the dermis in the face, supports other structures, makes us elasticity so we can move easy, joint flexibility, movement of the face, all of those things that, as we age are always affected by collagen.
Yes. Now, how does the collagen production change as we age? And I guess maybe the question is, why does it change as well?
For a couple reasons. So collagen loss is about 1% starting in your mid-20s. And then, but it becomes very evident by the age of 40. So like in your 20s, you're losing collagen, but you're not really noticing you're losing collagen. I mean, go back and look at a baby. They have those chubby cheeks. They have that very round face. So a lot of collagen in a baby. They're very flexible. Their skin heals and changes very easily. And then as you start to age, you notice that if you, sleep on the side of your face, now you've got a dent. And that dent may last for a couple hours versus popping up pretty quickly. You may notice that your knees don't bend as well, or, you're stiffer in your movements and stuff. So by the age of 40s to 50, it's a much more pronounced. your skin starts to get drier. And then by 60s, you definitely have significant loss. Your skin is thinner, it's less elastic, it's more fragile. And we all know that in healthcare, you take care of an elderly person, just moving them in bed or friction on a sheet, you start to see these weird bruises and stuff. So there's a lot of things that affect it. It's also then some external things too, like diet. So there's things we can do and there's things we can't do. Diet is a big part of it. Really, collagen is a protein. You should be consuming 1 gram of protein for every pound you weigh. And none of us are even close to that.
Okay, wait. I have a clarifying question on that. For every pound I weigh or for every pound I want to weigh?
Yeah, it's doing for what you weigh, and then you'll lose the weight to get where you're supposed to. But it just shows you how important protein is, and we're very bad with protein. I mean, all of us as a society. Things like genetics play a role. If you're from a certain ethnicity that wrinkles very easily, very fair skin, you're going to wrinkle. If your parents and had wrinkle skins, you're going to go the same way. Sun exposure. For some of us that are a little bit older that, use the baby oil and the copper tone and all that, it was tan. People that went through tanning beds. Yeah, I always say my one claim to fame is I've never, ever used a tanning bed. It's like my number one claim to fame. No, for whatever reason, I just don't think it was on my horizon. But it's really tanning beds. And even one tanning bed episode is enough to have damaged your skin. So tanning bed is huge. Lifestyle choices. Do you smoke? Do you use alcohol? Do you exercise? Sedentary is like, kind of equivalent to smoking now. So obesity, all of those things. And then, of course, overall health. How healthy are you? And there's a lot of fun challenges on Instagram and TikTok about identifying what your overall health is. And I encourage people to try it, like trying to put your shoes and socks on without leaning on anything and trying to get up from a sitting position without using your hands or your knee, extra support. They're just kind of cool things we should all do to kind of figure out where is our overall health.
Absolutely. That's so interesting to think about. When I was growing up, my mom was one of those that loved the tanning bed. So as a child, I would go put my feet in. She was in the tanning bed and I had to go with her. So I'd put my feet in the tanning bed. So yes, I've been around tanning beds when I was young, not even thinking about what happens to my skin. Oh, makes me sad.
Well, and as a side note, being a health practitioner, because you put your feet in, you need to check your feet all the time for melanoma. Even though it's a weird spot for melanoma to occur, it can occur. So you need to check your feet between the toes, the bottom of your feet, under your nails. Yeah, again. That you always get that health provider that comes through all this. Take that opportunity for education.
Yeah, and I'm sure there's a lot of people my age today whose parent, who tagged along with their mom and probably did the same thing because that's what they did back then. But now I know earlier you mentioned that collagen.
Healthier.
Yeah, that's true. Especially when you don't live close to a lake or a beach or that's what we did. So I know that you talked about collagen being in other areas of our body. And are we losing it as much in those other areas of our body, like our joints and our connective tissue, as we are in our skin?
We are. It's fastest in our skin, though. So, and that which would make sense because the skin is thinner. It's more exposed to things. You're not really exposing a joint or a bone to sun and all those kind of things. So it makes perfect sense. Most people, you can see this in your face. Your driving side, you'll always have more wrinkles underneath your eye on your driving side. And when you smile or squint, and that's because unless you're wearing sunscreen every single day and reapplying it, that sun is you're still getting the UAV rays through the window. But so you will lose bone. And again, you lose it in the bone. And that's very obvious when we do bone density, starting at the age of 65. The bones become more fragile. We all know as you age, your risk of developing a fracture is much higher. And again, that's because it's related to the loss in the bones. Joint and collagen for our cartilage formation, you start to see people start to have a lot of joint issues, knee replacements, osteoarthritis, joint pain, stiffness. Again, it's an aging thing as well as lifestyle choices. Tendons and ligaments decrease ability of strength and stretch. Your joint is becoming unstable. So then you become a higher risk of having an injury. So if you fall, you're going to get hurt. Decreased collagen equals decreased muscle mass and strength. So again, if you're not doing something, strength training, some sort of an exercise to build your muscle mass, normal aging and the breakdown of the protein is going to take care of it. Blood vessels become weaker. So you get more bruising, more varicose veins, potential for more cardiovascular events like heart attack, stroke, etc. Your eyes go through it. Decreased collagen in your eyes puts you at a higher risk of dry eye and cataracts and vision problems. So it really is every part of your body. The nice thing, though, is the loss does not occur at the same rate for everything. We talked about the skin is absolutely the most visible and immediate impact. And that's also secondary to environmental things, where joints, tendons, and muscles are going to be a gradual decline. It's not visual. It's more like a discomfort. I mean, when you talk about people that have joint issues, it always starts off the same. They start with a little knee pain, then the stiffness, then the inability to go upstairs. And then it just kind of gradually increases till they get to the point that they have significantly lost function. And then decreased estrogen. HRT, estrogen is a culprit too. It affects your collagen production. So, and again, it's all of those things that we talked about, the thinning of the skin, the loss of elasticity in the skin. So more sagging, more wrinkles. We all get those jowls.
Yeah.
Reduce wound healing. We don't even think about that, but it just takes longer for our skin and our body to heal without that collagen. Hydration. We forget about hydration, and it's such an aging symptom. As you age, your face becomes very dull. It also then opens the door to eczema, dry skin, psoriasis, all of those issues, which are common in the elderly. And we never think that it's really just related to a decrease of collagen.
Oh, I have a question for you, right? You are saying all of these things that are so important, things that we should be talking to our patients about, even if we're not in the facial aesthetics world.
Absolutely.
Why are we not talking about this? Why is this not part of identifying, hey, we need to do something here because it helps with wound healing, it helps with our bones, it helps with our joints. Why do we not hear this more?
Well, I think part of the problem is medicine is in the industry of illness fixing. We correct illness. We don't do a lot of preventative medicine. We just haven't gotten there.
Right.
But our whole healthcare system doesn't want preventative medicine. I mean, we have drugs that fix disease. We don't have a lot of drugs that help you with preventative. And we could do a whole thing on obesity meds and how, they're all fighting it because, the number one cause of illness is obesity. It's way up there. So I think we are so not into prevention. We also, the healthcare system is broken. You have few minutes with a patient. And really, you're just trying to figure out your coughing, your cold, just trying to get them to, you got high blood pressure, whatever. We really need to focus more on prevention. But our insurance model, our healthcare model, they're really not encouraging that. They don't pay extra for that. They pay you 15 minutes for an office visit, and you need to get everything done during that. And if you try to say, well, we did a psychological profile or we did some counseling, they don't reimburse for that. You know what I mean? So it really is it's much more complicated. I think things like in the aesthetics industry, we can spend the time. And I think that's great. Concierge medicine will constantly focus on preventative. My dad's 92 years old, lives in Florida, has a concierge doctor, and he is constantly focusing on preventative. So, but again, that may not be an option for everybody. Exactly.
For that, because we have some here in my area. And most people can't afford that.
Exactly. And Medicare is not going to pay for it. So, again, we're back into the cycle of we are a disease treating medical system, and we don't really, I think we're starting to get a little bit more, but I always tell everybody is look at your peer group, your, friends, family, whatever. How many of them are exercising 3 to 4 times a week? How many of them are eating well? How many are drinking minimal amounts of alcohol? How many are using sunscreen daily? I mean, there are a ton of preventative things that we all know. So I think it's just that we just have to keep singing it from the mountaintops, and hopefully they'll
pick it
get
up.
it. Yeah.
Yes. So going back to collagen, are there different types of collagen, because we know it's in all these areas of our body. Are they different types or one type?
There's actually like 5 different types of collagen. So we go anywhere from type 1, which is the most relevant to skin health, to type 3, which is the most abundant. And then like 2, 4, 5, they're kind of like scattered throughout the body. So for us, type 1 is the primary component of the dermis. So it's a deeper layer of the skin. It provides the strength, the structure, and the firmness. As we age, we lose that collagen. So things start to sag. They start to, get a little loosey. You get the jowls, you get the nasolabial folds, etc. Type 3 is the most abundant collagen, and it's found in the skin, the blood vessels, the organs, and the muscles. And it works along type 1, and it really helps with wound healing. So those are the 2 big ones. Where when we get to 3 is found in the cartilage and the joints. 4 is in some layer of the skin, pretty low. 5 is in the corneas and some layers of the skin and hair, which again makes sense that, again, we see most of it in the face, and then slowly we see the other systems that are affected by collagen. So again, type 1 and 3 are going to be the most relevant. They provide the structure, the strength, the elasticity, and the youthful, firm skin.
Right. So talking about the different types, what about you? I know you've mentioned UV exposure, you've mentioned, pollution, but how does that impact that? You said type 1 is the one in our skin?
Right. It's interesting you say that because, we all kind of know, like, don't go out in the sun because it affects your skin. Don't do this because it affects your skin. But, I don't know if I ever, exactly. I don't know if I ever sat back and said, I wonder why it affects my skin.
Yeah.
So it's kind of interesting to do this because I was like, oh my gosh, now I know exactly how it affects the skin. So the UV rays actually penetrate the skin and break down the collagen and elasticity. They literally break it down because they're penetrating the skin. So it triggers the production of free radicals. And if we all know free radicals are bad. They're kind of a byproduct. They run around. We try to take different supplements and do exercises and stuff to suck up those free radicals because they're damaging the cells. So they actually trigger these productions of free radicals, which are unstable molecules that damage the skin cells as well as the collagen fibers. So it's really just the light coming in that's penetrating the skin that's causing the damage. Hence the reason why sunscreen becomes so, so very important. So, and, they talk a lot about, this is UVA, this is UVB, this is, et cetera. But UVB is the shorter wavelength. So that actually causes the sunburn and the inflammation. And as you know, if you have an inflammation process, you're going to have cell damage. It kind of goes together.
Right.
UVA waves are longer wavelengths and they penetrate deeper. So those are the ones that are actually destroying the collagen. So again, UV exposure increases an enzyme which degrades the collagen and other structural proteins in the skin. They're called MMPs. It's a big long word, but basically it's just causing that damage, and it's just by penetration. So hence the whole really truly importance of sunscreen, 2 fingers, reapplying it every couple hours, that the majority of us are really bad at.
Yes. Well, and I don't know that I'd call this a controversy per se, but I see it every summer where people are talking about how bad sunscreen is. So I have to ask the question, are there certain types? I know not necessarily brands, but like certain types you should be looking for, because it seems like if there are chemicals in the sunscreen, then that would also play a role in damaging our collagen.
It does. And I think the best do it is use a mineral sunscreen and really look at the ingredients. One of the best advice I got from a dermatologist was use baby sunscreen, because that's going to be the purest form of sunscreen because it is highly regulated. We hope, yes. but it is highly regulated. And most of the time it's like a zinc oxide or something like that. It's not a heavy chemical fragrance. But some of the worst things are like the spray, because they have aerosols and stuff. They do not a good coating. So stay away from the sprays. Again, the powder is a little questionable because, you're rolling it on and is it working? The brush thing, who knows? I think I have on my face, I try to use a baby sunscreen. And then for the rest, I use a mineral sunscreen. But you can also look at sunproof clothing, the hats that are UVA, UVB protective, clothing that is UVA, UVB protective. So sunglasses, we forget about sunglasses, but that collagen damage is happening in our eyes. So like one of the biggest causes of cataracts, put your sunglasses on, especially good sunglasses that protect against the rays.
That's a really good point. I'm glad you pointed that out. So nutrition's got to be important too for not just our skin, but also our joints and our bones.
Super important. And again, it's the protein. When you look at collagen, since collagen is a protein that requires certain nutrients to synthesize. So we have to do nutrients. We have to add to them. The best way to get nutrients and supplements is through the food, hands down. Okay. Because then you know that your body's taking it. A lot of people take collagen protein, like they mix it in a smoothie or something like that. And the research on that is real iffy, because of the fact that collagen is good, but it has to go through your system of digestion to get out to the bloodstream, where it produces the amino acids of glycol, proline, and hydroxyproline. And those are the building blocks of collagen, but it has to get there. So if you take a supplement, you still have to kind of go through that whole process of it going in your stomach, being degraded by the acid. So that's going to be limiting. Same thing with your face. There's a lot of collagen products on the market, like put this cream on, put that cream on. What people don't realize is collagen is a very large molecule. It's not going to absorb through your skin. So you can put it on your skin and spend a lot of money on a product, but it's really not going to change the difference. But there are some things that will help you, like vitamin C. Every woman after the age of 40 and probably before should be applying vitamin C to their skin, because it is a cofactor which stabilizes and then adds some crossbody for collagen fiber. So a little bit of support. So again, really important, vitamin C. The amino acids that we just talked about, the glycine, the proline, the hydroxyproline, you can get those in bone broth, which I'm not a big fan of, but I have found if you mix it in like soup, like if you're making homemade soup and just throw in the bone broth, it's not too bad. But for me, just to drink bone broth, not a fan. But
not the guy either.
Yeah, but in soup, it's great.
But that's why I also have trouble getting protein, is because I'm not a fan of things like that.
I agree. It's so hard. Chicken skin. Who eats chicken skin?
If it's fried, fried
right. Fish, eggs, dairy products, legumes. I think the best advice I got on protein is look at ways to incorporate protein without knowing. So if I scrambled eggs, I scramble it with a cup of cottage cheese and a half a cup of egg whites. And then I scramble that all together and I just like multiplied the protein. If I'm going to have Greek yogurt, I mix it with a scoop of protein powder. So it's like you can do it with cottage cheese. It's always like trying to figure out how I can add something.
Without making it taste terrible.
Exactly. And it's hard. And I'm not a big meat eater. So, I'm not going to go out and eat like a 20-ounce steak. So I have to really look at protein a little bit different, switch to like eating jerky instead of, chips. And it really is about becoming so kind of obsessed with the amount of protein you're getting. Okay. Because again, it's going to release the building blocks for it. Zinc is another one. It's a coenzyme. It's going to help with the collagen formation. And again, shellfish, red meat, legumes, nuts, seeds, those type of things. Copper is critical in the cross-linking collagen and elastin fibers. Again, is going to increase the strength, increase the elasticity. Shellfish, whole grains, nuts, seeds, leafy greens. And again, this is, make sure you check with your own physician and make sure you don't have intolerances either. Proline, eggs, dairy, meat. Now we all just got to spend $1,000 on eggs, and then we'll just eat the same amount of eggs. Just do it for $1 million. Gelatin, I don't know. Omega-3 fatty acids is a great help. And then, of course, any antioxidants, the vitamin E, the beta-carotene products, they will all help. So just think colorful fruits and vegetables.
I heard a lot of repeats in there as far as the foods that you could eat. So I have to sit down and be like, all right, this one falls under all of these.
Yeah, there is. Again, protein, fruits and vegetables are going to be your best bang for your buck.
Yes, for sure. Now, when it comes to systemic conditions like diabetes and autoimmune diseases, what is the impact on the collagen production and our skin integrity?
Well, a lot of that has to do with collagen is a major component of blood vessel walls, and exposed collagen in the wound area helps attract platelets, and aiding in the clot formation triggers release of growth factors. So you can imagine if we have limited collagen, we're not going to have that homeostasis that's going to occur at that wound site. We're not going to have the protein that's available to heal that. So, and again, environmental factors, poor diet, sedentary, aging, genetics, all of those things are going to go to help. We all know that it's much harder to get a 90-year-old bed sore, decubiti, to heal than it is on a 40-year-old. Jada, we all know that. And so much of that is related to collagen. So what happens is in wound healing, you have that initial homeostasis where the wall ruptures, it calls in all the things, the growth factors come in. And then for the first 0 to 4 days, we're in an inflammatory stage. So macrophages are secreted to various growth factors, which stimulate the production of collagen. Some collagen will be deposited and it'll start it. Then the next phase is going to be the proliferative phase, and that can be 4 to 21 days. And that's where these fibroblasts migrate to the wound and begin synthesizing type 3 collagen. Interesting thing is now that we're moving in aesthetics to the use of collagen-based products like PRP, growth factor, PPP, we are coming in at this phase. Instead of doing homeostasis and inflammation, we're coming in with those products at this proliferative phase where we're actually bringing in fibroblast stimulation to actually start synthesizing and increasing that collagen to make it more flexible and less organized. Kind of looks like a scaffolding. So these products are actually causing a little scaffolding for it. And then, of course, the other stage, 21 days to 1 year, is going to be the maturation and the remodeling stage. So that's going to look at organizing, strengthening the collagen fibers. So as a wound matures, you're going to have scarred tissue become more flexible and more resistant over time because we're into that maturation remodeling phase. So it's a big process. I mean, up to a year, depending on, genetics, health, all of those kind of things, which is kind of scary.
Well, and just listening to you talk about the different stages of wound healing, I've seen a lot of wounds at the bedside, and I've never heard the word collagen come up when discussing how long it's taking and different treatments. And so I just wonder, as we learn more about collagen and we develop more of these products and things, if there is a way that this could be brought in to help people heal faster.
It is. And I think what we did at the bedside was we just used the term protein. We all know we were always checking serum proteins, albumins, total protein, all that. And I think we just said protein. Oh, you need a high protein diet. You don't have enough protein. As you age, you're not increasing your protein. So we use the term protein, which is basically what we're using for collagen. The new aesthetics is moving to using that as a way to do that, but it's also moved into wound healing and skin therapy. So skin wound clinics now are using the PRP products, the growth factor products, the PPP, and it's just a whole new avenue that's out there. And it's amazing because it doesn't have that homeostasis or hemostasis inflammatory process. It starts at the proliferative phase. So we got rid of all that, the stuff that kind of makes the bad stuff, and we just start at a good level. And you're seeing it a lot in wound clinics. We're seeing more and more of it being used in wound clinics.
That's really good to know. I didn't know that we had moved in that direction, but it makes sense. It makes sense that we go there.
Yeah, absolutely. Absolutely.
Well, thank you so much for this information you have shared through this first episode. We are out of time, but man, you really opened my eyes to the importance of collagen. We go into this thinking it's just our face. We're talking about our face and collagen, but collagen is really important for the majority of the things that happen in our body. So
absolutely.
Thank you.
I learned so much myself.
All right. Well, I hope that you will join us for episode 2, where we're going to discuss innovative treatments and techniques to help with skin rejuvenation.
This podcast featured content from an accredited CE activity provided by Colibri Healthcare. Visit elitelearning.com/podcasts for accreditation and disclosure statements and instructions on how you may be able to earn CE credits. Take your learning to the next level by subscribing to more podcasts on compelling healthcare topics.